Dr. Fatunde, you're an orthodontist, and however, I want to talk about small children, and sometimes I think the belief of parents who, when they have a small child and the baby teeth are kind of falling out. In fact, in my case, my father helped me pulling them out, literally with a plier, with a string around and the door, and no replacing was going on. And basically, those are the baby teeth. Other teeth come in. Why worry? Basically, why should a mom make sure that the baby teeth stay good, that they get their fillings done if needed, that a tooth, even literally not like an implant with an adult, but gets replaced because or things, and should be monitored because they're baby teeth. They disappear. And by 12 or so, the new ones come out. What's the big deal? Why spend time and money on fixing those little teeth, which are going to be gone anyway soon? Can you shed some light on that?
Thank you. Early loss of teeth, especially in baby teeth, has a lot of effect on the jaw. The teeth influence the way the jaw grows. If you see an older person and a tooth and who has lost a tooth, over time, that area of the jaw where the tooth was lost becomes thinner than the other areas where the teeth are. Therefore, it's important for the baby teeth to stay on for as long as needed so that, one, they can keep the width of the adult teeth, which oftentimes are much larger than the baby teeth. Number two, the presence of the teeth also stimulates jaw growth. So it's important that baby teeth be kept as long as needed so that the intrinsic growth potential of the jaw is not in any way minimized. In addition, the baby teeth often, you could say, kind of a guide for the adult teeth. Most of the adult teeth, if you have the privilege of looking at a jaw skeleton, where if you can cut it in section, you will see that the adult teeth are most of the time growing right under the baby teeth. Therefore, when the baby tooth is lost, in a way that guidance is lost. Then when it comes to the adult teeth coming in, if the baby tooth is still present, the adult teeth begins to advance into the mouth. And as they advance into the mouth, then they erode the root of the baby teeth. And that's when the baby teeth get loose. And the further the adult teeth advances, the looser the baby teeth get until the baby teeth are pushed out. In the absence of the baby teeth, there is dense bone over that adult tooth that's trying to push into the bone. And so the adult tooth then has a lot more work to do to be able to push through dense bone rather than push out the baby teeth that was there and the path of advancement is already present. In addition, when a baby tooth is lost early, because wherever there is space, teeth will tend to gravitate towards that space. So if a baby tooth is lost early,
it's like a fence. The teeth, it's like a fence. If you have one ball missing, the other one starts becoming crooked. So now
exactly. So when a baby tooth is lost, you want to preserve that space. One, to prevent the adjacent teeth from bleeding in, and secondly, to preserve that space for the adult teeth that would replace it.
Got it. So what you're saying is the baby tooth. Number one, I really didn't think of that. I did realize that tooth bones, jaw bones get lost when you lose your teeth. That's why our grandmas looked like dried out tomatoes, because they lost so much teeth. And now that can be prevented with an implant stimulating the root of a tooth. I was not translating it to children. And here's the thing, many of us parents, or I'm not a parent, but we don't realize it because from my parents, well, it's the baby tooth. And let's get it out. But yes, if you already, as a small baby, just like when you exercise as a kid and as a young adult, it stays with you a little bit. It's not that you become that you stay very strong if you stop, but still it stays with you a little bit that you wear as a young. So if the bone here grows or doesn't grow as a young, that probably changes the facial structure of the boy or girl, which probably is not in a positive way. And then you say that the next tooth is almost using the first one as a channel. Almost like the first tooth drills the hole and the second one comes through it a little bigger, but the hole is already there, rather than if you take it out, no more hole, and the tooth gets sidetracked all over the place, which is then the big tooth. And now you have to straighten him out with lots of, braces and all kinds of stuff and time.
Right.
So basically parents should be they should spend time and money to get those baby teeth, keep them as long as they should, and that's why they should probably also go to the dentist/orthodontist to make sure that if a tooth doesn't want to come out when it should come out because the other one is there, that you guys do take him out, right?
Right, we'll send them to the dentist to take out the baby teeth. If we see that the adult teeth is ready, but for some reason the baby teeth is not given away.
Right. But so basically a tooth could fall out too fast or stay in too long, doesn't want to leave, and then either way you get your permanent teeth growing very crooked.
That's possible.
Yeah. And let me ask you, as a doctor, have you noticed that, the 7, 8, 9, 10-year-old children, as they still have their baby teeth, that they are also more conscious about their looks and their teeth than we adults think, because, we think that Wayne thinks that starts something at the age of 16 and 17 when we start dating. But have you noticed it, that children actually, because I see some children, they're beautifully dressed, they care, a little spot, they don't like it. So why wouldn't they also be wanting to look good in their mouth? Have you noticed something like that? Also, that's another factor rather than the health factor?
Yes, that's part of it. It's at that age, there's what we call the pubertal growth spurt going on. The body is growing rapidly, but at the same time, there's a lot of influx of the hormones. So the children are suddenly changing from the young elementary kids who didn't really care about their looks, and all of a sudden there's a lot of bodily changing and they're becoming more aware. And that part of awareness is also being aware about how their teeth look, and that influences their self-esteem, especially when the teeth are crooked or the smile is not optimal. So that's part of one of what drives the need for treatment, in addition to whatever else may be needed. Now, is it possible that a young teenager or 12-year-old comes into the office and the teeth are perfectly straight, but the patient, still feels a little bit self-conscious? Yes, that's possible. And if the patient comes in and there's really no need for braces except for the self-consciousness, then we want to look at, what is the patient's concern about that smile? And be able to explain to that patient how functionally that smile is optimal. And then look at what the patient is really concerned about. And sometimes it's a little empathy. It could just have been another child made fun of her. But if we can look at what's driving that emotional state, then we can be able to educate the child about the state of the smile and whether braces is needed or not.
Well, wonderful. Extremely interesting topic. So anyway, parents should make sure that they bring their child to the dentist, to the orthodontist very regularly, and pay attention of the baby teeth and how the other teeth are going to be growing. Thank you very, very much.